So you have 4 valves in your heart, and each one of them can either become too leaky or it can become too tight. One of them is called regurgitation, the leaky, and too tight is called stenosis.
For patients who have bad valves, valves that either don't open well or don't close well, a lot of them we can fix, so we can repair their valves. But for some patients who have valve disease that's fairly advanced, those valves need to be replaced, and then we replace those as well.
Oftentimes for the mitral valve, patients will have been followed for their mitral valve for many years. They have a hard time wrapping their heads around the fact that they have to have surgery because they're asymptomatic. They feel fine. It's very difficult for them to feel like it's the right thing to do to have surgery because they don't even feel bad. A lot of people don't want to have their breastbone cut. And so a lot of the minimally invasive options either cut less of the sternum with a much smaller incision or don't cut the sternum at all and instead go between the ribs. That helps patients because they recover faster. They have need for transfusions after surgery, and just cosmetically, they're left with smaller incisions. The robot really enhances mitral valve surgery. The robot has a camera that is a 3D camera, and it is 10 times magnification relative to what your eyes are. So you can see all the parts of the valve much more easily. And then the robotic arms, which I control, and the robotic instruments have 360-degree range of motion. When you are operating robotically, you can see better and move better than when you do one of the cases without the robot. Many centers may offer robotic surgery, but just the presence of a robot doesn't equal a team of experts using the robot. For me, it's very routine to use the robot. That is my comfort zone. And that's exactly who you want to be doing your robotic surgery, somebody who feels that it's a routine procedure, not something, a big grand event that they do every so often. You want somebody who feels like just a normal day at work when you're doing something with the robot.
At a place like New York-Presbyterian, Weill Cornell, we are a tertiary, or even what is now referred to as a quaternary referral center. If you look at the acuity and the complexity of what we do, we are focused on those patients who have a higher degree of complexity and a higher risk profile, simply because, number one, we have the experience to do it and do it well, and number two, we have the resources available to take care of them.
If someone was considering valve surgery at this hospital, the one thing I'd want them to know is that we'll be able to offer them all of the options, and then that they are going to be cared for by a whole group of very experienced caregivers, and that they will always be placed first in the priority list.